When we have slightly rotated teeth, to make them straight, do we need to cut or we can add? Minimally invasive case with composite utilization, especially for you in our new issue. Let's go. Hello dear colleagues, hello dear friends, we are back in our BG Dental Cases reviews. This time I'm happy to present you a very nice and very minimally invasive case where direct composite restoration can be used to have or to get aesthetic result and in a very minimally invasive way. So here we have initial situation, and our patient was a pretty young lady. She asked us to cut her distal areas of central incisors, and the reason why is that these teeth were slightly rotated, where distal margins were protruded and mesial areas were slightly retruded. Let me show you that picture so you'll be able to see that better. Basically, she wasn't happy with that. She said that these distal zones are very prominent and the mesial ones are in shadow, and there is a big step between central incisors and lateral incisors. So even she gave us a solution what actually she would like to have from our side. She said, please cut my distal zones and these teeth will become straight and I will be happy to have that kind of smile.
This video is about benefits that you will have from our online workshop. Presence effect. This is a unique feature by Belgrade Academy that literally moves you to our training center and you can stay close to speaker. This is like over-shoulder format. The training process is filmed through the video system from the microscope, and there are two more cameras broadcasting close-up and general view. This way, you can see everything in precise details. Efficiency. Do you agree, guys, that over-shoulder workshop with detailed video and explanation is way better than regular slides? The third benefit is convenience. So basically, you don't need to go anywhere and you can study in comfort conditions, in your home, in your office, during running exercises, from your phone, from your computer, from your tablet, and you can do anything you want with the content. So join us as we shifted online education into the next level.
So I tried to make her happy with the result, but I also wanted to make result as minimally invasive as possible. So I started to analyze case from different perspectives. Even just having this photo and having our graphic software, like, you know, you can use iPad like I use iPad now for making some drawings. So what we can have, for example, let's try to design case just in front of you. We have that picture. This is a very important picture to have, by the way, the picture from incisal area, straight to incisal area. So if we will add a bit of composite here, okay, and also we will add some composite layers on the laterals, I think the result will be way better. Okay, just having that perspective gives us possibility to understand that we can be really good in terms of invasiveness. So we decided to add. From the palatal side, we had old fillings and caries defects that we for sure have to treat. This is very important, you know. And then from the vestibular area, we sandblasted zones where we were going to add some composite portions. It is our mesial areas on central incisors and also mesial areas on lateral incisors. So we decided to go there with direct bonding. So we performed sandblasting, then etching, rinsing, bonding. And since we didn't have a lot of space to work with different layers of composite, but we wanted to make some slight characterization, we decided to use some tints before final layer of enamel. So basically we used only one layer of composite, which was chromatic enamel, and just some characterization like blue tint in mesial aspects of teeth and some ochre tint in a very mesial central parts of central incisor, as you can see. And then we placed some chromatic enamel, made some finishing and polishing, and here is the result that we were able to obtain with a direct composite restoration. So you see that in some cases, instead of preparing, instead of cutting, we can add. And the good thing from composite restoration is that really direct composite is one of the most minimally invasive materials and approaches, because there is no pathway of insertion. You can place it wherever you want. You can sculpture it, you can layer it, and then you can integrate it, and then you can polish it, and everything will be super all right and happy. What I would like to say also is that if you are looking forward to have a very good composite training, including direct restorations, direct composite restorations for anterior, posterior teeth, composite veneers, and also indirect composite restorations like full mouth rehab cases, for example, copy-paste technique, injectable technique, we're happy to welcome you in our training center here in Kiev, Ukraine, for very advanced big composite course in RubyDem. It's just 2 days for 7 people only to train your composite skills to the very next level. For other people who are looking forward to have some free education, I would like to say that here on our YouTube channel, where you are here, we have a lot of useful information and useful webinars. Like when you go into our main page, YouTube, then you can go to playlists, and in that playlist you may find very nice case reviews like this one with a step-by-step, and you will have some clinical tips and tricks. Also, we have a very short video tutorials like 1 dental minute. This is the name of series, the 1 dental minute, where just within 60 seconds we are giving you some very nice dental tip. Also, we have some interviews with the dental stars. So basically our YouTube channel became a very nice educational platform thanks to you guys. So if you want us and you together with us grow, don't forget to put likes, to follow us, and to share these videos with your friends. May the dental force be with you guys. See you next time. Bye-bye.